Hello and welcome to webinar series. Shanti here this side, and today's a very important topic is all about the early post-operative ambulation. As we know, surgery without mobilization is incomplete recovery. So, and we are going to talk about few benefits as well for this discussion. Now, I like to welcome Dr. G. Nagasumant, the group of physiotherapists from Yashoda Hospitals. I welcome you,
Th-
Sumant.
Thank you. Thank you, ma'am. Thank you, Shanti, ma'am.
Yes. And let me also welcome all our speakers in the panelist, Ms. Sajita, who is a nurse manager from Post-Op Recovery, Yashoda Hospital, Secunderabad unit. Also, Merin from High-Tech Yashoda unit. And we do have fresher nurse who is Bindu from Dev College of Nursing, Hyderabad. I welcome you all.
Thank you,
Okay,
ma'am.
so
Thank you.
yeah. So this is going to be a very interesting session. Please keep this time in bound. This is going to be a little time bound. And so first, as we go with the discussion, my first insight would be from Sumant. I
Yes.
will go with this quote like, his early ambulation is just like a medication. Over to you.
Yes, ma'am. Early ambulation definitely is a medication because the first and foremost thing is early ambulation, it boosts the patient confidence. That is the key for a future pathway. Okay. And early ambulation is not that easy and it
Yes.
varies from specialty to specialty. So we need to go according to the case.
Thank you. And we are just going to, engage you for the rest of the slide. Let us see what we have in the rest of the discussion. Yes. Over to you, Sajita, as we like to start with the definition in simple terms. Over to you, Sajita.
Yes, ma'am. Very good afternoon, all. First of all, I would to thank to Shanti ma'am for giving this opportunity to attend this session. Let us go to the topic, ma'am. What is early ambulation? Is it irrespective of surgery or any specialty? Yes. The definition of ambulation is mobilizing the patient out of bed within 6 to 24 hours of after the surgery, which involves assisting patient at bedside, like make them stand, sit, and make them to walk uh, for shorter distance and help them sitting within 24 hours of surgery with significantly reduced length of hospital stay.
Yeah.
Yes.
Yes.
Yeah.
So,
Yes, ma'am.
I think this is the reason I have just made this question mark here. It is only you, Dr. Sumant, who can tell us the time duration and how fast we can mobilize, first of all, and ambulate, take the patient for ambulation. Over to you.
Yes, ma'am. Definitely, ma'am. The ambulation definitely depends upon the type of surgery. So it's
Yes.
not the standard for all the surgeries. In
Yes.
orthopedics also, it will vary from surgery to surgery. Okay,
Yes.
that we need to get to know.
Yes.
Sorry. So that
Yes.
and when it comes to abdominal surgeries, for example, like Whipples. Okay, for
Yes.
example, like
Yes.
Whipples, the criteria not only the ambulating the patient. Before ambulating the patient, what are our prerequisites we need to check? When to and there was a question when to mobilize the patient. So
Yes.
the patient, if the patient is if he's taking less than 5 liters of oxygen, yes, he's ready for ambulation. So that first we need to take the clearance from the surgeon. Okay.
Yes.
So once we get the clearance from the surgeon, then we need to do. And the importance, the advantage of doing an early ambulation is, as you mentioned, definitely it reduces the length of the stay in hospital, ma'am.
Yes.
As I said before, first thing is it boosts the confidence. The patient will be under the myth that I have undergone a very big surgery. I need to be in bed for longer time. But it's not. It's not.
Yeah.
So when he stays in the bed for longer time, okay, psychologically he will be down, and moreover, we are not activating the other systems. The advantage for ambulating early is you'll be activating all the mechanoreceptors of your body when it comes to musculoskeletal wise. When it comes to abdominal surgery, you need to regain the motility of your intestine. Okay,
Intestine.
so
Yes.
that
Correct.
comes effectively with ambulations. So
Ambulation only, yes. So yes, as you cleared a little bit about myth versus fact towards mobilizing the patient, yes. So let us also see a little indication for the same. Yes, over to you. No, I think it is Merin? Yes, Merin.
Yes. Okay. Good afternoon, all. Good afternoon, all. Thank you, ma'am, for giving me this opportunity. And myself, Marin, I'm working as a staff nurse in post-operative recovery. So, as a post-operative nurse, I'm encouraging my patients to mobilizing the patients early for preventing the listed complaints like DVT, deep vein thrombosis, as everyone know about the DVT, and pulmonary embolism, pneumonia, atelectasis, and constipation, and pressure ulcers for chronic bedridden patients and all.
Okay.
Yeah. Then we can see this one. So many important reasons for ambulating the patient on day 0 after surgery. So even sitting potential complications like blood circulation. Yeah, blood struggles in the legs. Walking pumps blood back to the heart and reduces the risk of deep vein thrombosis and pulmonary embolism. And also, bowels start working again, less bloating and less ileus, and patient can eat sooner. Then sitting up plus walking and deep breathing prevents pneumonia. Like,
Yes. So, as she presented, Dr. Sumant, you think these are the few very important reasons for ambulating the patient because nurses bedside may not the importance, especially freshers. They may just stick to their medication protocol,
Yeah.
and feeding patient, talking to the attenders, preparing the discharge summaries. But what about this, challenges which you are here to clear this? Yes, over to you.
Yes, ma'am. As Merin said rightly, it's very important to, so if we mobilize the patient early, we can reduce all these complications because when the patient tends to sleep up straight, what happens? The full this stomach, everything will be pushed up, and you don't have a time. Means the lung can't expand much. That's when we make patient upright, the patient mobility starts increasing. When thoracic mobility starts increasing, as she rightly mentioned. So before doing a mobilization, we need to encourage a patient good pattern of respiration. Good
And
pattern
I
of
think,
respirations.
yes.
Suppose for example, in diaphragmatic incisions, any incisions, because of the severe pain, what happens? Biggest thing what happens is diaphragm muscle will get inhibited. When the diaphragm muscle is getting inhibited, the patient start doing a shallow breath. He will be using his axillary muscles. He will be using his axillary muscles. So when he uses the axillary muscles, the saturation will be very less. We can improve the saturations effectively by activating the diaphragm muscle effectively. Just
Yes.
making them upright and keeping the both hands and the lateral aspects of your what lower thorax can activate your
Yes.
diaphragm. And
Yes.
giving a good passive movements or encouraging the active movement at the bedside, improve the circulation. We can prevent your DVT and pulmonary embolisms.
And
And early ambulations. Yes, ma'am.
and so to here head of the bed also to be elevated, to be kept
Yes.
elevated
Yes.
because I think it might also prevent the chances of aspiration pneumonia,
Yes.
as you
Yes, ma'am.
rightly said. Yes.
Yes, and
Yes.
not only this aspiration, the aspirations are one thing, ma'am. Other important thing is orthostatic hypotension,
Yes. Yeah.
especially
Yes.
in Whipple surgeries. So making the patients lying straight and making them to sit, it causes an orthostatic hypotension. And slowly we need to keep them in semi-flawless positions. Gradually we need to make them up, and
Yes.
slowly we need to check all the parameters. Then we should make them stand. Then
Yes.
we should make
Not
them stand after
yes.
making them stand. Before doing an ambulation, nurses and physiotherapists should know when to
Yes.
progress, when to regress.
Yes.
So while they are sitting, we need to check the basic parameters, their blood pressure, their respiratory rate, their heart rate, their saturations. We need to check if anything is dropping means don't progress. Stop for a
Yes.
minute and encourage them per sleep breathing. Encourage them per
Yes.
sleep breathing. So if it improves within 2 minutes, is the time to progress. If it is not
Yes.
improving, if it is deteriorating, don't progress. Sometimes we get instructions the patient has to walk. No, we should have a strict guidelines for walking. We need to check the criterias. We need to check the criterias because these are all very high-end surgeries and very critical surgeries. Okay, we should not make the patient Just patient should not
yeah.
fall. So we should
Yes.
follow the very strict guidelines.
Yes. As you rightly pinpointed, that fundamental ambulating process to be adhered before the patient,
Yes.
of bed criteria. Yes, yes. Going
Yeah.
forward, what is happening with the muscles? I think we do have a Bindu who is going to present this slide. Yes, Bindu, over to you.
Good afternoon, all. I am Bindu, fresher graduate nurse from Dev's College of Nursing. As Sir told rightly regarding the benefits of early ambulation, we also have other important criteria, which is muscle strengthening, and also patient will feel confident while he stand early after the surgery. He feels confident and he will also think that he may get discharged rather than the expected date earlier, and also he will be confident psychologically as he is standing by his on his own on the day zero. It will improve the psychological presence during his hospital stay. And I wish to also say that patient confidence increases, the patient discharge will also get better.
Yes. And here we wish to learn from you all. I mean, to understand from you, Bindu, Sajita, and Mary. What stops you all not to initiate the, little fundamental factors about the mobilization? Yes, you can see different kind of surgeries we are trying to present here. Yes, Bindu, what is your mindset like? Yeah, over to you.
Ma'am, in the everyday clinical scenarios, we watch mobilizing of the patients who undergone the minor surgeries. But talking about the critical surgeries, like orthopedic surgeries and patients with the heavy tubing like external ventricular drainages, and during the Whipple surgeries also, post-operatively, we will see lot of tubings connected to the patient. So while ambulating them as nurses, we will not have that confidence, and we will have that fearfulness of tubes getting misplacement or misconnections during the movements. So that one is the one which makes us to be fearful and careful. So I wish
So,
to learn from the sir what kind of care to be taken during the ambulation of this kind of patients, and what about the mobilizing techniques we can use. I wish to learn from the sir. Over to you, sir.
Okay. So, yes, ma'am, as Bindu madam said rightly, so this ambulation criteria varies from specialty to specialty. And before slide, she has mentioned about we can activate the muscles. As I mentioned earlier, so when the patient becomes upright, we'll be activating all the mechanoreceptors. These mechanoreceptors are there wherever your muscle, wherever your joints are there. Those mechanoreceptors are present. When they started activating, your muscular function starts improving. So when you stand erect, so when you teach them proper breathing pattern, you can slowly calm down the pain. And when you start them when you teach them good pulse breathings, what happens is your vagal nerve activation will be there. When the vagal nerve activation will be there, your sympathetic nerve system will be activated. The patient will get calmed down. And when it comes to the specialty, as Bindu ma'am was telling, yes, first slide, it is a very important slide for us for orthopedics. So in orthopedics, we are not seeing only the TKR cases, we are not seeing only the ACL cases. And each and every case is different, and each and every surgery is different. It depends upon the bone quality, it depends upon the surgeon expertise. Okay, so for example, most of the time doctors will say partial weight bearing, non-weight bearing, okay, toe touch weight bearing to 50%, such instructions will be there. We need to see those instructions very carefully when we need to do the ambulation. Sometimes when non-weight bearing is indicated, we might cause a problem. So as well as when it comes to a scopy, only ACL surgery weight bearing is different. Combination with meniscus weight bearing is different. So it varies from patient to patient, surgery to surgery. And sometimes it depends upon the bone quality also. Okay, so when it comes, as Bindu madam was talking about the Whipple surgery, so among all the surgeries, my biggest challenge we have for ambulating the patient is the Whipples. Because as she rightly mentions, too many drains, and we need to check when the patient is in ICU, when we get in a referral where the patient has to be ambulated in the ICU. Okay, their biggest thing is we need to take care of central line.
Yes.
So So what I personally feel, ma'am, while we are ambulating we need to categorize some conditions. What are the criticalities of ambulations? Among this, we should keep a top line to this Whipples, next transplant cases. So where nurses and physiotherapists should work together.
Together, yes.
I need to know their job. They should know my job.
Yes, yes.
Okay. So for an
Yes.
effective outcomes, ma'am, for effective outcomes. So
Yes.
Whipples, Bindu madam, need not to get scary. It is very easy. Only thing in Whipple surgery is, good thing is that rightly, so when you make a patient to, when you make them sit, the biggest thing is the patient keep on getting that giddiness. The reason for getting a giddiness is there, because of big incisions, their diaphragm is turned out, their abdominal muscles are turned out, so they won't be having an effective respiration. So they don't take oxygen properly. First, before ambulating, teach them proper exercise. Teach them proper breathing exercise. Make them slowly from semi-false position, slowly from 30 degrees, slowly make them sit upright. They will get a confidence. So as I mentioned earlier, while sitting, we need to check certain criteria. So if we go through, then we should make them stand, go through. We should have Shanti Mesham, you should provide us good supporting staff for holding.
Yes, yes. That remains a lot of, these
Yeah,
similar
because of
challenges,
many
yes, for the
things, and
nurses
we need to.
also.
And biggest challenge while ambulating the Whipple's patient is we need to check the parameters regularly, madam.
Yes, yes.
Okay,
So
we
going
need to.
in continuation, we do have, we also wish to understand from Marine and Sajita, like as you were saying that a lot of prep to be done before you, make the patient off bed. So my question remains the same from Sajita. Are nurses or you see your junior nurses, are they scared to mobilize even? Sometimes doctor comes and tells, like, ankle pump should be done, the patient can be little, from supination, right or left can be moved. So my, query is, are you all scared? Like Sajita, over to you.
Yes, ma'am. Sometimes we scared about the mobilization.
Yes.
Kind of
Why?
situations. Sometimes there is a chance of delining of catheters, ma'am, and the
Okay.
patient may complain severe pain.
Yes.
There is a fall risk, and
Yes.
lack of confidence, and
Yes.
there is a very lack of training, ma'am. Junior
Yes.
staff will be there. That is that kind of situation. We are very afraid about this
So
early.
now I request Sumant, if at all he teaches you little range of motion, will you all be able to do? Yes. Okay. So that was good, very valid point, because we see in the ICU a lot of patients with a ample number of catheters, lines, TVT pumps, ventilator tubing, ECMO, and arterial lines, etc. That is the reason nurses may not be little confident of taking the patient off bed, not with the critical severe patients. Yes. Yeah. Over to you, Marine. What you as a post-operative nurse, what is your fundamental care you wish to provide to the zero POD patient? Yes, with the
Yes,
instruction of
ma'am.
the doctor and
Yes.
physio.
Yes, ma'am. No, ma'am. I would not be so scared about the ambulating the patient or mobilizing the
Okay.
patient because I'm in recovery area.
Ah,
This is not a this is what I'm saying. This is not a optional for us. It's a
okay.
practical. It is a part of recovery treatment.
Yes.
So I'm trying to mobilize him. I'm not about telling the ambulation in critical patients. I'm telling mobilizing. Gradually, we
Okay.
can mobilize the patient first. Then only we are ambulating the critical things.
Yes, very good. As you said, it is not an option. It is a
Yes.
part of nursing care. Very valid point. Yes. Yeah. Going forward again, I think yes. Yeah, Bindu. Regarding tell us little bit about ankle pumps. Yes, Bindu, over to you. Then Sumant can come in the picture. Yes.
Now, patients sometimes, when we do the mobilization on the bed, for them, especially ankle pumping will give the most relaxation, and they feel mentally and physically more stable after the ankle pumping. Like inversion, eversion, when we do on the bed, the patients will tell us, yes, we are feeling somewhat stable now. So I wanted to learn from the sir what is the physiological process behind this of saying from the patients.
Yeah. In short, yes. Sumant,
Yes,
over to
ma'am.
you.
In simple, it's simple because when you're moving a joint, you're activating all your proprioceptors. You will get joint position sense, one thing. And when we are moving the joint, your circulatory system will be improved. That's the reason they feel better.
Yes. And Sumant, Dr. Sumant, I wish to again understand whenever you send your team and you try to, give escort or assist working for any patient, I think
Yeah.
this questions they will always ask you, when will I be healthy enough to stop exercising? Do they?
Ma'am,
Yes.
so we should not stop exercise, ma'am.
Yes.
Keep
Yes.
doing exercise.
Yes.
Exercise is not only for recovering, it is exercise is also for preventing.
Yes. And the functional gain of the patient. Yes.
Yeah,
So
functional
that,
gain.
yes.
We should not
Yes.
never stop doing exercise.
Yes, I think this is also very important slide, and Marin would like to, communicate. Yes, Marin,
Yes.
over to you.
Yes, yes, ma'am, absolutely. The painkillers and assurance is a very huge role in before ambulating the patient. Then in and after surgery we can check the vitals of the patient first. Before we mobilizing, first we have to check the vitals of the patient and pain. Uncontrolled pain, it is lead to high BP and high heart rate, that and all. Then first we have to check the vitals of the patient and pain of the patient, pain level of the patient. And then we have to disconnect the all required IV lines, their pumps and all. And then first we have to give the semi-fowler's positions. And then assurance, medicine is an half of the work and assurance is the second half. So we
Very right.
can give
Yes.
psychological support of the patient. Okay, na?
Yes.
Psychological support and small exercise. Then gradually we can ambulate the patient. First we can tell the range of motion exercise like flexion, extension, rotation, and all we can give. And deep breathing exercise also. It is prevent to pneumonia and all.
So, my, insight would be from you, Dr. Sumantis.
Yes, ma'am.
What could be the active bed mobility exercises, which is in terms of range of motion, like because these are very simple exercises which
Yeah,
nurses, while infusing the medications, while communicating, she can always pamper the patient
yeah,
for
we can
doing so.
encourage patients to do.
Yes,
The-
yes,
the,
and
uh,
I, yes, over to you.
Yes, ma'am. These are all the small things because unless and until you remind patient repeatedly, so that not only patient, a patient attender, we should empower the patient, but sometimes the patient won't be in a position to
Yes,
do.
Yes.
So we need to empower the patient attender.
yes,
So they should make a patient as a responsibility to do such exercises. And definitely because early moving the joint, it helps in preventing the stiffness and
yes, yes.
activating the muscle. That in long term, slowly it helps in declining the usage of painkillers will be decreased.
Decreased,
And
yes.
one more important thing she was mentioning about the pain while ambulating. So there is
Yes.
a link between the pain, respiration, and ambulation, ma'am. Because when the patient, definitely after any post-operative surgery, the patient will be under fear.
Yes.
When he start doing an ambulation, out of pain, he starts doing a breath hold. So those things we need to stop. We need to counsel the patient. We need to first emphasize on the breathing pattern correctly. So we need to, if the breathing pattern is good, so he can't hold the breath, then ambulation will be easy.
So yes, a few questions. We urge all the viewers to take few questions before you tell your patients to just ambulate. Of course, yes, with a very able and expertise department like physiotherapy under able guidance of Dr. Sumant, and we do have different, seniors in every unit. Yes, and we have come to the end of the sessions. I urge all the viewers to refer www.yashodahospitals.com for more simple health, academics topic and evidence-based learning. Stay tuned, and then I wish I request all the speakers to just share this link so that knowledge is disseminated to everyone. I thank Dr. Sumant for your beautiful and very valid presentation. I thank Bindu, I thank Sajita and Merin. We end the session. Yes, Sumant, over to you for your last take-home message.
Keep doing exercise.
That's it. Yeah, it applies even for healthy
Yeah.
individuals and
A
at the
healthy
same time for
individual
the
or any
patients.
patient. Keep doing
Yes,
exercise.
yes. Thank you. We end the session.
Okay.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank
Okay,
you.
ma'am. Thank you, sir.
Thank you.